Hello and a warm welcome to my presentation. My name is Durjana Chetri. Today I'm going to present about advanced care planning and its effect on a patient and their family satisfaction with care. I will also provide a comprehensive overview of ethical decision making and finally talk about the requirements for effective communication. First, let's start with advanced care planning. What is advanced care planning? Advanced care planning is the process of discussion between patient, their families, carers, and those looking after them about their healthcare goals and wishes. Advanced care planning is an essential part of improving care for people nearing the end of life and for providing better care to help them live well and die well as per their wishes. It allows people to talk about and write down their future healthcare wishes, which increases the chances that their wishes will be understood and respected at the end of life. It is particularly important conversation between someone who faces a challenging reality as they approach the end of their life and someone who cares for them, their family or close loved ones and their care provider. Participating in advanced care planning has been associated with higher satisfaction with care, lower rates of depression and anxiety among family members, and significantly lower healthcare costs. Advanced care planning allows patients to consider, discuss, and record healthcare choices that says that they would like to get. It helps family and healthcare professional to know the patient preferences and provide the care that they want. As the end of life care decisions can be difficult and challenging to make by the family and loved ones, it is much easier to make decisions when healthcare goals are made in advance. When there is an advanced care directive to guide, there is an increase in satisfaction of care among patients, families, and healthcare providers. Therefore, advanced care planning is linked to positive outcomes for our patients and their families' satisfaction with care. Now I'm going to explain the comprehensive overview of ethical decision making concerning advanced care planning. Some of the ethical principles are autonomy, beneficence, justice, and non-maleficence. Let's talk about two ethical decision making principles. Autonomy. Autonomy refers to a person's ability to make their own decisions and express their values. Advanced care planning enhances individual autonomy and control over medical decisions. An advanced care directive extends a person's autonomy to the point of incompetence. Patients' autonomy refers to their ability to make their own decision. This means that nurses will ensure that patients have all the information they need to make an informed decision about their medical care. The nurses have no say in the patient's decision, obtaining informed consent from the patients for treatment, accepting the circumstances when a patient declines a drug, and keeping confidentiality are all examples of nurses displaying this. Respect for autonomy or a person's freedom to make decisions and govern their own life is at the heart of advanced care planning. Justice. Justice is defined as fair, equitable, and appropriate treatment of persons. It involves the concept of fairness and equity. The ethical concept underlies that healthcare providers do have a duty to both community and individual patients to treat them equally and fairly. Medical reasons in the healthcare sector are often neglected. Therefore, it is an ethical principle to provide equal treatment and should be distributed fairly and equally. Effective communication make it easier to identify and handle physical, psychological, social, and spiritual issues holistically. To meet patients' expectations, beliefs, aspirations, and values, effective communications can be helpful. While communicating distressing news and providing emotional support, healthcare professionals need compassionate communication. Advanced care planning discussion can be challenging, complex, and sensitive. Effective communication is helpful to connect with patients. It can assist to know the patient's priorities, values, and wishes. Every patient has various communication requirements which may vary over time. There are several things you may do with each patient to aid communication. Some of the requirements for effective communication in the context of palliative care are as follows. Be silent when necessary, active listening, touch if appropriate, be honest and respectful, provide support and company for the person dying and family members, avoid medical jargon, use simple language as much as possible, be respectful and empathic. Hence, these are some of the requirements for effective communication with palliative care patients and families. And lastly, I want to thank everyone for listening my video.